be all right.
Preventive lifeguarding is probably one of the most important things that we do as guards. If you can avoid most of the saves by preventive lifeguarding, your job is much easier.
Teamwork is very important just because every single thing that you do there is going to be part of a team.
If he stopped looking for a second, that could be the second that he went under and I didn't see him.
The best thing I could say is when you actually have your first save ever, because you just have that rewarding feeling. It's, yes, I did my job. You know, I saved someone from dying or drowning. That is the best reward that I've received. It's my very first save. And not that it was even anything big, but I did it.
All you need is that one time when you realize, well, gee, all my training was worth it.
It's a great job. It's a lot of responsibility. It's more experience than you think. I consider it, the part of my life.
As a lifeguard, sometimes you have to make really important decisions. Sometimes those decisions are a matter of life and death.
Most of the time the decisions you make have nothing to do or aren't connected with emergencies. They have more to do with how you interact with the other members of your team and how you deal with the patrons.
Any problems?
No problems.
It's pretty common to run into people who break the rules. Some of them might not be aware of them. Others might not understand them. And then there are those who just like to cause trouble. You have to decide how you're going to handle them all.
When I was in lifeguard training, I learned about a way to make decisions. It's called the FIND model. Here's what FIND stands for. F, figure out the problem. I, identify possible solutions. N, name the pros and cons for each solution. And D, decide which solution is best. Why don't we look at how the FIND model might work in a real-life situation? This is Jess. She's a good guard, always aware of what's going on around her. But once in a while, she sees a potential problem.
Walk, please. Sir, please take the child off your shoulders.
Oh, that's okay. She loves it up there.
This is a situation where the lifeguard has to figure out the problem. Since Jess is responsible for the safety of everyone using the facility, a patron who ignores her request to stop breaking a rule is definitely a problem. Now she has to decide how she's going to react. So she needs to identify the possible solutions. Here are a few solutions Jess considered.
I thought to myself, what are my options? I could, 1, ignore the guy and hope he eventually puts the kid down. 2, show the guy who's boss, yell at him, and throw him out of the pool. Or 3, I could warn the guy again, and this time politely but firmly explain why I shouldn't carry the kid on his shoulders.
Jess identified 3 solutions to the problem. The next step is to name the pros and cons of each possible solution. A good guard has to think about what the consequences of each solution might be.
She loves it up there.
Solution number 1, ignore the guy and hope he eventually puts the kid down. Pro, if I ignore him, I don't have to confront him. And besides, he'll stop soon eventually. Con, if I ignore him, then he might fall or accidentally drop the child.
She loves it up there.
Solution number 2, show the guy who's boss, yell at him, and throw him out of the pool. You, sir, out of the pool! Pro, if I yell at him and throw him out of the pool, then I've removed the unsafe situation and people won't get hurt. Con, if I lose my temper, he might get mad, and that'll only make things worse. An unhappy customer, a talk with the boss.
She loves it up there.
Finally, solution number 3. Warn the guy again, and this time politely yet firmly explain why he shouldn't carry the child on his shoulders. Excuse me, sir, but we don't allow anyone to carry another person on their shoulders. It's just too easy for someone to get hurt. Con, he might still ignore me, in which case I call the supervisor for help.
So we've got 3 possible solutions, all with pros and cons. By identifying the problem and naming the pros and cons, you've got all the information you need to decide which solution is best. Which solution is best? Let's see what Jess decided to do.
Excuse me, sir, but we don't allow anyone to carry another person on their shoulders. It's just too easy for someone to get hurt.
Okay, honey, legs down.
The FIND model can help you make all kinds of decisions, and it won't be long before it becomes second nature. If you run into a problem and can't decide which solution is best, ask the head lifeguard or the facility manager. They've got a lot of experience in dealing with patrons and problems. With FIND, you'll be able to take any situation, figure out the problem, identify possible solutions, name the pros and cons, and decide which solution is best.
The rescue tube is a lifeguard's most important piece of rescue equipment. The rescue tube has enough flotation to easily support the weight of the lifeguard and multiple victims. Rescue tubes come in a variety of sizes and styles. They have attached shoulder straps and tow lines that vary in length. Always wear the rescue tube properly. Shoulder strap in place, looped over your head and one shoulder. When you are seated in a lifeguard chair, lay the tube across your thighs and hold the excess line in one hand. This will prevent the line from getting caught on the chair or other objects when you climb down from an elevated station or when entering the water from an elevated station in an emergency. When conducting surveillance standing, hold the tube horizontally across your stomach and hold the excess line. Whenever you are on duty, have your rescue tube in place and ready to go. Always take it with you when you enter the water. The stride jump entry is appropriate only in water that is at least 5 feet deep and only from a height of 3 feet or less above the water. Squeeze the rescue tube high against your chest and hold the excess line in one hand. Lean slightly forward and leap into the water with one leg forward and the other back. As you enter the water, squeeze your legs together in a kick to provide upward thrust. The buoyancy of the rescue tube along with this kick will bring you to the surface. The compact jump can be used to enter the water from a height greater than 3 feet from the surface, such as from a lifeguard stand. It can also be used to enter shallow water from the deck. When entering from a height, the water must be at least 5 feet deep. Squeeze the rescue tube against your chest and hold the excess line in one hand. Jump out and away from the chair and pool deck. Keep your knees bent and your feet together and flat to absorb the shock in case you strike the bottom. The buoyancy of the rescue tube will help bring you back to the surface quickly. After entering the water, you can approach a nearby victim using a modified breaststroke or the modified crawl. In either approach, keep the rescue tube under your armpits and your head up as you swim toward the victim. If the rescue tube slips out from under your arms, you can let the tube trail behind you. As you near the victim, slow your approach. Bring the tube forward. Position it high against your chest and under your armpits, and continue the rescue.
I got you. You're all right.
Depending on the situation and the victim's condition, you may use different rescue techniques once you reach the victim. You'll learn more about these skills in another lesson.
Surveillance is really an important job of a lifeguard.
Preventative lifeguarding, that's what we practice here. That's what we have to practice here.
The number one job of a lifeguard, more or less, is safety. Because you don't want to have to make the rescues. We're not here just to make the rescues. We're here to have a safe facility.
It's very important to always keep your eyes open and always be alert.
You have to stay focused on the pool.
As a lifeguard, you are responsible for protecting the lives of the people at your facility. Preventing injuries is your job.
No dunking!
Watching for potentially dangerous situations and knowing how to recognize distressed swimmers and drowning victims are critical skills for a lifeguard.
Recognizing a victim is extremely important because a distress situation can become a drowning situation in a matter of seconds.
There's always a brief moment where you're asking yourself, are they in trouble or are they playing? And once you feel that they're in trouble, then obviously you have to make a move and you blow your whistle.
A victim may struggle for as little as 20 seconds before submerging. Most people who drown in guarded facilities drown because no one notices that they are in trouble. Not even the people who are right next to them. In guarded aquatic facilities, 3 factors can lead to drowning. A swimmer who gets into trouble may drown if the lifeguard surveillance is hindered by any one or combination of these 3 factors. The first is failure of the lifeguard to recognize behaviors that indicate a person is drowning. Second, the intrusion of other duties that take a lifeguard's attention away from the responsibility of patron surveillance. And third, any distraction, however brief, divert the lifeguard's attention away from constant surveillance. Remember these 3 factors: recognition, intrusion, distraction. These are called the RID factor. RID are 3 factors that may cause a lifeguard to miss a swimmer in trouble in the water, which can lead to drowning. When other duties divert your attention away from patron surveillance, make certain that another guard is covering your area. As a lifeguard, you must be able to recognize the difference between the behaviors of swimmers, distressed swimmers, active drowning victims, and passive drowning victims. Knowing how people behave when they are in trouble allows you to respond quickly, often preventing a situation from getting worse. Swimmers have different levels of ability in the water. But in general, the body position is nearly horizontal, and their arms and legs are moving in a coordinated and effective manner. Swimmers also have breath control and can make progress through the water. distressed swimmer behaves differently. Exhaustion, cramps, or sudden illness are a few of the reasons that might cause a swimmer to become a distressed swimmer. A distressed swimmer makes little or no forward progress in the water and might not be able to get to safety without help. You can recognize distressed swimmers by how they try to support themselves in the water. Some will float. Others will try to tread water. A distressed swimmer usually has enough arm and leg control to keep his or her face out of the water and may even be able to wave and call for help.
The way I can recognize a distressed swimmer is usually they're on top of the water, they have been swimming laps, for example, they develop a cramp, or they're too tired to make it to the side of the pool, and they call out for help generally because their head's usually above the water.
Without help, a distressed swimmer will become exhausted and anxious and eventually become an active drowning victim. An active drowning victim may struggle at the surface for as little as 20 to 60 seconds before submerging. Once the victim goes underwater, they may continue to struggle. Because this stage of drowning can be so short, it's important that you know how to immediately recognize the behavior of an active drowning victim. When a person begins to drown, instinct takes over and the body reacts with automatic physical responses. This reaction is similar in all active drowning victims. These behaviors are called the instinctive drowning response. First, an active drowning victim's instincts focus on one purpose, breathing. The head is back as the mouth sinks repeatedly below the surface during the struggle to keep the face out of the water. The victim extends his arms out to the side and presses down for support to raise his head out of the water. The victim is not in control of her own muscle movements and at this point is not able to wave or call for help. Her body is vertical in the water. The legs will have little or no supporting kick. An active drowning victim makes no forward progress in the water. This struggle at the surface may last only a short time before the victim submerges, and once underwater, the victim may continue to struggle and soon lose consciousness and stop moving. A victim who has stopped struggling or who slipped below the water without a struggle is called a passive drowning victim. A passive victim may be floating face down at or near the surface or may sink to the bottom. To be safe, someone who is floating face down and motionless for about 30 seconds should be regarded as a passive drowning victim. Because you often have only a few seconds to recognize someone who needs help, you must develop an effective method of scanning your area of responsibility. Scanning is more than just looking at the people in the water. Scanning is paying attention to the behavior of every patron so you can recognize any signs of distress or drowning.
I try to scan from one end of my area to the other end of the area consistently. I try to always keep my eyes or head moving.
As you scan, note the activities of the people in your area. Look and listen for sounds that could indicate trouble.
We're still concerned about everybody else in the area, but there's certain people you know to key in on just by how they're behaving in the water, whether or not they're going underwater with ease, they're getting their face wet, they're getting their head wet.
You may need to use different scanning techniques for different facilities and stations. An elevated station, such as a lifeguard chair, gives you the best view of patrons in the water. But remember to scan areas you cannot easily see, such as the water directly below your lifeguard stand. Try to keep this area clear of swimmers at all times in case you have to enter the water quickly to make a rescue. If your station is on the deck or in the water, your view of the entire swimming area is more limited. And never turn your back to the water. At a crowded facility, you may be assigned to a walking patrol. In this position, you are adding to the coverage being provided by other guards. This allows you to see individuals who might be obscured by crowds or in areas difficult to see from guard stands. No matter where you are stationed, stay alert and avoid distractions. In most facilities, lifeguards will rotate from one station to another. To relieve a lifeguard at an elevated station, take a position next to the stand and begin scanning. The other lifeguard comes down, and once on the deck, continues scanning. To complete the rotation, the relieving lifeguard climbs into the stand and resumes scanning. Exchange any important information before the other guard leaves the area. To relieve a lifeguard at a ground-level station, stand at her side and begin scanning. Ask if there are patrons who need closer supervision.
Any problems?
No problems.
Okay, I got it. It's important to keep your eyes on the pool during your rotation, because at any time something can go wrong and someone can go under, get hurt.
During rotation, you need to communicate well with the guard that you're switching with in order to establish who has watch over the pool.
At least one guard should be watching the area at all times, otherwise no one's watching the area and no one else is going to be.
When multiple guards are on duty, swimming areas are divided into separate areas of responsibility called zones. The size of the zone you are responsible for covering is different depending on the size of the facility, the number of people in the area, and the number of lifeguards available. In this example, the pool is divided into 4 zones. Guard number 1 is responsible for covering the area marked in red. Guard number 2 is responsible for covering the area in yellow. Guard number 3 covers the area shown in green. And guard number 4 is responsible for covering the diving well, shown here in blue. Notice that each of these zones overlaps other zones. This double coverage helps ensure that no part of the pool is unguarded. Some swimming areas can pose many surveillance challenges. While the pool itself is not very large, its shape may create blind spots, areas of the pool that cannot be seen easily from certain lifeguard stations. And remember, there are blind spots directly beneath an elevated station at the base of the chair. If you are working alone, you must provide total coverage. This means that you are responsible for guarding everyone in the water, as well as those on the deck. Play structures are common to many aquatic facilities. They include slides, rope swings, sprays and fountains, and floating toys. If your facility has play structures, be familiar with how they work and what hazards they may present.
You look for kids not coming back up after they go under, or if they do come up, if they can make it to the side. At the lily pads, you watch for if they fall off, if they hit their head, if they're going to be okay, if they're going to be able to make it to the side. At the log, you watch if they get whipped off, if they're going to hit their head in the brick. On the hippo, you watch if they fall under, if they're going to make it back up.
Control how the patrons use play structures in order to maintain adequate supervision of the area. Remember, you must be in a position that allows you to see around and under play structures. Different facilities present different surveillance challenges. Take the time to learn about the characteristics that make your facility unique, and work with your fellow lifeguards to be certain that no area is left unsupervised.
People think of lifeguards, they think of people who run in the water and save people. That's the last thing that you want to do. You want to create a safe environment for them and prevent the drownings and injuries before they happen.
the more you promote safety, the less rescues you have, and the more successful summer that you have at your pool.
As a professional lifeguard, you must be able to make decisions quickly. An emergency action plan provides a step-by-step approach for responding to emergencies. Knowing your facility's emergency action plan, or EAP, prepares you for responding to and managing an emergency. Remember that you are never alone in a crisis. You are a member of a safety team. However, you need to understand everyone's role on your team, and everyone on your team needs to know and practice your facility's emergency action plan. The emergency action plan starts when someone recognizes an emergency situation and responds. Recognition activates the EAP. Look again at the actions that activate the emergency action plan. Before you leave a station, give a prearranged signal such as a whistle blast to notify other staff and patrons of the emergency. Your signal tells other lifeguards that you are responding to an emergency and that they are to assist and cover your area.
Clear the pool!
We have all four on staff right now for that day. Right. Melissa's gone in. Go help her out.
Got it.
Next, the general water rescue procedures are activated as part of the emergency action plan. These procedures vary from facility to facility. The lifeguard enters the water and assesses the victim. Is this a distressed swimmer, active drowning victim, or passive drowning victim? Based on the assessment of the victim, perform the appropriate rescue and bring the victim to safety.
All right, reaching. Got him.
If the victim is unconscious, remove him from the water immediately. Use a backboard with the assistance of another lifeguard or bystander.
Okay. All right, I'm rotating victim. There we go. Pull.
Once the victim is removed from the water, provide emergency care. You need to know first aid and how to provide care in emergencies. Always follow basic precautions. Wear disposable gloves and use breathing barriers to prevent disease transmission. Next, check for consciousness and assess the victim's condition. This is called the primary survey.
Are you okay? Can you hear me?
To do a primary survey, look for any life-threatening conditions such as unconsciousness, no breathing, no pulse, or severe bleeding.
Yes, we have an emergency here. We're at the Tuckahoe Recreation Club.
And always get consent when providing first aid. If the victim does not respond, you have implied consent to continue.
He's got a pulse, but he's not breathing. One 1,000, two 1,000, three 1,000, four 1,000.
Okay, I'll call 911, and they should be here soon. I also called the director, and he'll be here soon, too. Sounds like they're doing.
Once emergency medical help arrive and take over, notify the chain of command.
1,000, two 1,000, three 1,000.
With a serious injury, illness, or death, the head lifeguard or facility manager notifies the appropriate supervisor as soon as possible. The supervisor contacts the victim's family.
Can you tell me your phone number?
662.
As soon as possible, a designated safety team member interviews witnesses. These interviews are conducted confidentially and in writing.
And tell me, what did you see?
I was standing on the side of the pool, and I was watching everyone swimming. The one swimmer appeared to be swimming fine across the pool, and then he just went limp. We weren't sure if it was a joke or not, and then we heard the lifeguard blow the whistle.
The lifeguard who made the rescue fills out an incident report. Other safety team members may also assist in completing the report. Equipment used in the rescue is checked, and damaged or missing items are replaced and reported. If the facility was cleared during the incident, all required equipment must be back in place before reopening. In addition to equipment, anything that may have contributed to the incident is corrected before reopening or as soon as possible.
All right, I've reviewed the incident reports. I spoke with the doctors at the hospital.
A facility staff meeting is the final step in the emergency action plan. If the incident involved a serious emergency, follow-up staff discussion provides the opportunity to share information and discuss problems.
I know this year you instituted that in-service training program. You ran the EAP every single week, and it worked like a charm today. So congratulations to you. I think it was an excellent idea.
This helps provide a complete picture of what happened before, during, and after the emergency.
And I scanned over to look at someone else that I thought might be in trouble, and when I scanned back, I noticed that the victim was face down.
In the event of an emergency on dry land involving someone becoming suddenly ill or injured, follow rescue procedures as outlined in your facility's emergency action plan. The EAP becomes activated when a lifeguard recognizes and responds to an emergency.
Jack! Jack, are you all right?
When approaching an emergency, survey the scene to be sure it is safe. A lifeguard must be prepared to provide first aid as needed.
It's Annie. I know first aid. Can I help you?
Yeah.
I need some help here! Let me...
You will learn more about first aid in other lessons.
EMS is on its way.
Okay. Here, let's keep him warm.
Yeah.
The skills you learn could save a life. To review, the steps of an emergency action plan are: recognition of an emergency, activate the emergency action plan, activate general water rescue procedures if needed, notify chain of command, interview witnesses, complete reports, check equipment, take corrective action, and follow up with staff discussion.
Using good surveillance techniques helps you prevent many aquatic emergencies. But always be prepared to make a rescue at any moment. After you recognize that someone needs help in the water, activate your facility's emergency action plan. Then, follow the general water rescue procedures when faced with an emergency involving a water rescue. First, enter the water safely. The type of entry you choose will depend on the depth of the water, the height from which you enter, and the design of your facility. In some cases, the lifeguard may not have to enter the water. and may be able to reach the victim from the deck.
Can you grab the ladder?
Once you are in the water, approach the victim. Keep the victim in sight at all times. Assess the victim's condition as you approach. As you get close, always place the rescue tube between you and the victim. When you are in position, perform an appropriate rescue. Knowing whether the victim is distressed, active, or passive will help you choose the most appropriate rescue to use. Once you have a secure grasp, move the victim to safety. When you reach the side, use a backboard to remove the victim from the water. You will need another lifeguard or bystander to assist. Always follow basic precautions, such as using disposable gloves and breathing barriers.
Are you okay? Can you hear me? He's not responding. Has someone called 911?
They're on their way.
Once you remove the victim from the water, you may need to provide emergency care. You will learn more about first aid and CPR in other lessons. To review, when you recognize an emergency in the water, activate the Emergency Action Plan and follow the general water rescue procedures. Enter the water. Approach the victim. Perform the appropriate rescue. Move the victim to safety. Remove the victim from the water. And provide emergency care if needed. Depending on the situation and the victim's condition, you may use different rescue techniques once you reach the victim. To help a distressed swimmer who is close to the side of the pool, use an extension assist from the deck. Remove and hold the rescue tube's shoulder strap, extend the rescue tube, and encourage the victim to grab on. The extension assist is used to reach a victim who is close to the deck. It is good for a tired swimmer, but it may not be good for a drowning victim because he may be struggling too hard to reach the tube. Once the victim has grasped the rescue tube, lean back and slowly pull him to safety.
Can you grab the ladder?
If the victim cannot reach or hold onto the tube, you have to enter the water.
You gonna hang out in shallow end?
Another simple technique for helping a distressed swimmer is called the swimming extension rescue.
Got it?
Approach the victim from the front and extend the end of your rescue tube to the victim.
Everyone, you got it?
Tell her to grab the tube for support.
Can you help me kick a little bit?
Once she's holding onto the tube, move her to safety. Ask the victim to kick if she can. A technique called the active drowning victim rear rescue can be used for either a distressed swimmer or an active drowning victim. Approach the victim from the rear. Keeping your rescue tube between you and the victim, reach under the victim's armpits and grasp her shoulders. Lean back and pull the victim onto the rescue tube.
It's okay.
Use the rescue tube to support the victim and keep her face out of the water.
It's okay.
Calm and reassure the victim as you move towards safety. Distressed or active drowning victims may grab onto each other as they try to stay at the surface.
I got you.
If you are the only lifeguard responding to this situation, use the multiple victim rescue. Approach one victim from the rear. reach under his armpits and grasp his shoulders, keeping the rescue tube between you and the victim. Lean back and pull the victims onto the rescue tube. This will help bring their faces out of the water.
I got you.
Support the victims in this position. Call for help. Do not attempt to move the victims to safety without assistance from another lifeguard. If no assistance is available, encourage the victims to kick toward the side of the pool. Another rescue technique is called the passive drowning victim rear rescue. Use the passive victim rear rescue when the victim is unconscious and you do not suspect a head, neck, or back injury. You will learn more about head, neck, and back injuries in another lesson. Approach the victim from the rear. Keeping your rescue tube across your chest, reach under the victim's armpits and grasp his shoulders while keeping your head to one side. Roll the victim over so he is face up on top of the rescue tube. Move the victim to safety. In some cases, a guard may need to swim with the victim for a longer distance. It may be easier to move the victim to safety using one arm to swim. When the victim is in position on the tube, reach one arm over the victim's shoulder and grasp the rescue tube. Use your other arm to swim. Sometimes you need to perform a rescue below the surface in deep water. A feet-first surface dive helps you submerge quickly. When you are over the victim, let go of your rescue tube. While vertical, press downward with your hands and use a strong kick to raise your body up out of the water. Take a breath and let your body sink toward the bottom of the pool. Keep your legs straight and together with your toes pointed down. When your downward momentum slows, turn your palms outward and sweep your hands and arms upward. The submerged victim rescue is used to rescue a victim below the surface beyond your reach. It can be used for both active and passive submerged victims. Do a feet-first surface dive and position yourself behind the victim. Reach under his arm and across his chest. Grasp the toe line, pull it down, and place it in the hand that is holding the victim. As you reach the surface, place the rescue tube between your chest and the victim's back. Reach under the victim's armpits and grasp his shoulders. Move the victim to safety. On rare occasions, a distressed or active drowning victim may grab the rescuer. This is a dangerous situation. It can happen if the rescue was faulty or if the rescue tube slipped away while conducting the rescue. Always use your rescue tube for support. But if you lose your rescue tube, you can use the front or rear head hold escape to get away from the victim. If the victim grabs you from the front, do the front head hold escape. Take a deep breath, turn your head to either side, raise your shoulders, and then submerge with the victim. If the victim has not let go once underwater, bring your hands up to the victim's arms, near or at the elbows. Push the victim vigorously up and away from you, keeping your chin tucked, your arms fully extended, and your shoulders raised. Keep pushing until you are free. Once free, swim out of the victim's reach and surface. Then, reposition your rescue tube and use a rear approach to complete the rescue. the victim grabs you from behind, do a rear head hold escape. Take a deep breath, turn your head to either side, raise your shoulders, and then submerge with the victim. If the victim has not let go once underwater, bring your hands up to the victim's arms near or at the elbow. Push vigorously up and away from you while twisting your head and shoulder. Keep your chin tucked, your arms fully extended, and your shoulders raised. Keep pushing until you are free. Once free, swim out of reach of the victim and surface. Then reposition your rescue tube and use a rear approach to complete the rescue. After moving a victim to safety, you may need to remove the victim from the water depending on his condition. The victim may be unconscious or unable to climb out of the water. 2 lifeguards or a lifeguard and a bystander are needed to remove a victim from the water safely. A backboard is required and should be readily available. Generally, an assisting lifeguard or bystander gets the backboard while the lifeguard in the water performs the rescue. Time permitting, the assisting lifeguard prepares the backboard, removing the straps and head immobilizing. To perform the removal from the water, first, bring the victim to the side of the pool and rotate him to face the deck. The assisting person on deck grabs the victim's wrists, crossing his arms to grab right to right and left to left, then slightly pulls the victim up, keeping the head above the water and away from the pool edge. The primary lifeguard removes the rescue tube and gets the backboard and guides it straight down into the water until the top is about the same level as the top of the victim's head. Keep the victim's head from falling forward. The assisting lifeguard turns the victim onto the backboard. Each rescuer quickly grasps one of the victim's wrists and the top handhold of the backboard. They pull the backboard and victim together up and onto the deck. Lift with your legs and not with your back, resting the bottom of the board against the edge of the pool. Step backward to slide the backboard and carefully lower the victim on the deck. Provide immediate follow-up care based on the victim's condition.
Grab the tube.
Using the skills you have seen here will help you perform effective rescues. Remember, lives depend on your ability to act quickly and effectively.
He had tipped over, and he's face in, and the life jacket and floating unit were submerging him and keeping him feet up instead of face up. And all I remember after that was jumping in and coming up with the kid in my arms. He could have died. The lifeguard has to keep a level head and perform his skills as best as possible at every time.
If I hadn't been there and I hadn't known exactly what to do and I hadn't been trained as a lifeguard, this man could have possibly died.
As a professional lifeguard, giving first aid and CPR is an important part of your job. Just as you will make water rescues when patrons are in trouble, you will be expected to give first aid and CPR when patrons become injured or ill.
As a lifeguard, you have to know first aid because that's your job. It is to save people if they get in trouble. And people expect that you know first aid.
You're the first line of response. You're the first person that people are going to look for when there's a medical emergency.
Just as you will be called upon to make split-second judgments in response to emergencies, you will be required to make decisions regarding when and how to give appropriate care. Recognizing emergencies and knowing your facility's emergency action plan prepares you for managing emergencies.
All right, I'm rotating victim.
When activating the EAP, you and your coworkers react to an emergency situation that may call for first aid and CPR. Remember, you are a part of a safety team, a group of people who work together in an emergency.
I need some help!
Even if you are the only lifeguard on duty, it is critical to keep teamwork in mind.
Place it over the cut.
You may depend on and get support from people around you,
Can you go to the office, have someone call 911? I have someone bleeding severely.
and you may depend on emergency medical assistance from outside.
Apply pads.
In addition to first aid and CPR, a professional lifeguard should be trained in automated external defibrillation. Automated external defibrillators, or AEDs, analyze the heart's rhythm and, if necessary, prompt a rescuer to deliver an electrical shock to the heart.
Shock advised.
Preparing to shock. I'm clear, you're clear, we're all clear.
The timely use of an AED combined with CPR gives victims of cardiac arrest the best chance of survival. Oxygen administration is another important skill. Lifeguards need to know how to manage breathing emergencies using oxygen, suctioning devices, and airwaves. To learn more about AEDs and oxygen administration training, contact your local Red Cross. Being prepared to do your job means knowing when and how to respond to all kinds of emergencies. Whether it is a drowning victim or an injured or ill person, a lifeguard must be prepared to give first aid and CPR.
Even minor injuries need to be taken care of. In a situation such as cardiac arrest where the results could be fatal, it's important to be able to assess the situation and take care of that need.
Deliver shock now. Shock delivered.
Hey, can I get some help?
As a lifeguard, there will be times when you come into contact with blood or body fluids. Although the risk of getting a disease while providing care is low, you need to recognize situations and know how to protect yourself and others from disease transmission. Therefore, it is important to use protective equipment such as disposable gloves and breathing barriers when providing care. Infection happens when pathogens, such as germs or bacteria, enter the body. Pathogens cause diseases like hepatitis and meningitis, and can be transmitted from one person to another in many ways. Direct contact poses the greatest risk because infection can happen when someone touches or comes in contact with an infected person's blood or body fluids. To prevent disease transmission, follow basic precautions. Whenever possible, avoid contact with blood and other body fluids. Always use protective equipment such as disposable gloves and breathing barriers. Always wash and scrub your hands thoroughly with soap and water immediately after giving care. Protective equipment such as disposable gloves are designed to prevent contact with blood and other body fluids. Therefore, it is important to use them correctly. Use latex, vinyl, or nitrile gloves and have these readily available in first aid stations, first aid kits, and fanny packs. To remove soiled gloves, pinch the first glove at the wrist. Be careful to touch only the glove's outside surface. Pull the glove toward your fingertips without completely removing it. The glove is now partially inside out. Next, remove the second glove. With your partially gloved hand, pinch the exterior of the second glove at the wrist. Pull it toward your fingertips until it is inside out, and then remove it completely. Next, grasp both gloves with your free hand, being careful to touch only the clean inner surface of the gloves. Discard soiled gloves in an appropriate container, such as a biohazard bag. Wash hands thoroughly with soap and water immediately after giving care. Wash and scrub your hands for at least 10 to 15 seconds. Washing hands frequently is the most basic precaution you can take, particularly after contact with other people. And it is important to always change gloves between contact with different people. Remember, never reuse gloves or use gloves that are defective or torn. Never touch or handle any personal items when wearing soiled gloves. Other kinds of protective barriers are resuscitation masks and bag valve masks. These are used to protect against disease transmission when someone must breathe for a victim. You will learn how to use breathing barriers in other lessons.
Okay, stay calm.
To prevent disease transmission, avoid contact with blood and other body fluids. Use protective equipment. And wash your hands with soap and water. These are some of the most effective ways to safeguard yourself, your fellow lifeguards, and patrons against disease transmission.
He's not breathing.
As a professional lifeguard, there may be times when you need to breathe for victims who cannot breathe for themselves. To help prevent disease transmission during rescue breathing, you should use a breathing barrier called a resuscitation mask or pocket mask. Although resuscitation masks may vary in size and shape, they all have common features. A pliable rim, which helps provide a good seal around the victim's nose and mouth, a clear dome, and a one-way valve. Some masks have oxygen inlets for use with supplemental oxygen. Smaller masks are available for children and infants.
He's not breathing.
To use a resuscitation mask, first assemble the mask. Attach the one-way valve. Kneel behind the victim's head and place the rim between the lower lip and chin, and lower the mask until it covers the mouth and nose. Seal the mask and open the airway. Place your thumbs on each side of the mask. Slide your fingers into position behind the angles of the jaw. Apply downward pressure with your thumbs, lift the jaw, and tilt the head back to open the airway. Press firmly on the mask to ensure a complete seal. Then breathe for the victim. Take a breath before you give a breath.
He's not breathing.
There will be times when you may have to position yourself to the side of the victim. To use a resuscitation mask in this position, kneel next to the victim. Position the mask to cover the victim's mouth and nose. Seal the mask and open the airway. Apply downward pressure, lift the jaw, and tilt the head back to open the airway. Breathe for the victim. Take a breath before you give a breath. The one-way valve opens to let your breath pass through to the victim and then closes to prevent the victim's air and body fluids from reaching you. This reduces the risk of disease transmission. You will learn more about rescue breathing in another lesson. In review, to use a resuscitation mask, assemble the mask, position the mask, seal the mask and open the airway, and breathe for the victim. Following your facility's emergency action plan can help save lives when emergencies occur. Once you have performed the general water rescue steps to safely remove a victim from the water, perform a primary survey to help determine whether the victim has any life-threatening conditions. Before you begin, survey the scene to be sure it is safe. Follow basic precautions, such as using disposable gloves and a resuscitation mask to prevent disease transmission. To do a primary survey, first check for consciousness. Tap and gently shake the victim and shout.
Are you okay? Can you hear me?
If the victim does not respond, have someone call 911 or the local emergency number immediately. Unconsciousness is a life-threatening condition.
He's not responding. Has someone called 911?
They're on their way.
Next, check the ABCs: airway, breathing, and circulation. To open the airway, tilt the head back and lift the chin. Put your ear close to the victim's nose and mouth. Look, listen, and feel for breathing for about 5 seconds. If the victim is not breathing, place your resuscitation mask over the victim's nose and mouth. Seal the mask and open the airway. Give 2 rescue breaths. A rescue breath should last about 2 seconds. Breathe just enough to make the victim's chest clearly rise. Then remove the mask and check for signs of circulation. Signs of circulation are normal breathing, coughing, or movement in response to the rescue breaths, or a pulse. To feel for a pulse, locate the Adam's apple and slide your fingers down into the groove on the side of the neck. Look, listen, and feel for signs of circulation for no more than 10 seconds. Finally, check for severe bleeding. Look carefully from head to toe. The care you provide depends on what conditions you find during your primary survey. If you find an unconscious victim who is facing down or in an awkward position, try not to move her. Check breathing by positioning yourself as close to the victim's nose and mouth as possible, and look, listen, and feel for breathing. If the victim is not breathing or you can't tell, roll her over onto her back. Begin by lifting the arm on the side the victim will be rolled to, up above the head. Place one hand on the victim's hip and the other hand on her head and neck. Roll the body as a unit, being careful to support the head and neck as she turns over. Next, open the airway and recheck breathing for about 5 seconds. If the victim is not breathing, continue with the primary survey. The care you provide depends on the conditions you find. If the victim is breathing and you do not suspect a head, neck, or back injury, place the victim in the recovery position by rolling the victim onto her side. Begin by lifting the arm on the side the victim will be rolled to, up above the head. Secure the other arm by placing your hand over the victim's wrist and next to the hip. Place your other hand behind the head and neck and roll the body as a unit, being careful to support the head so that it is angled toward the ground. Bend the top leg and move it forward. Next, place the victim's hand near her mouth and nose. Then place the top leg over the bottom leg. Once in the recovery position, the victim should be turned to the opposite side after 30 minutes, or if there are signs of loss of circulation to the lower arm, such as pale, ashen, or grayish skin that is cool to the touch. If an emergency occurs on land, activate the emergency action plan by alerting the other members of your safety team. Then proceed with the primary survey.
I need some help here.
As you approach the incident, survey the scene. Determine whether the scene is safe, what happened, how many victims are involved, and if any bystanders can help. If the scene is unsafe, take the victim to a safe place before you continue care. Once you are sure the scene is safe, do a primary survey. First, check for consciousness.
What happened?
I cut myself on the table.
If the victim is able to speak clearly and answer basic questions, she is conscious and alert. If the victim is conscious, always get consent before providing care.
My name is Kim. I know first aid. May I help you?
Yes.
Okay, take your hand, place it over the cut. It'll help slow the bleeding. Raise your arm slightly. Need you to go to the office, call 911. I have someone who's severely bleeding.
Okay.
Call 911 or the local emergency number if the illness or injury appears to be serious or life-threatening. To review, in an emergency situation, activate the emergency action plan and perform the general water rescue steps to remove a victim from the water. Once the victim is safe, do a primary survey. Check
Are
for
you okay?
consciousness.
Can you hear me? Are you
If the
okay?
victim does not respond, have someone call 911 or the local emergency number.
Someone call 911?
Then check the ABCs, airway, breathing, and circulation. Check for breathing for about 5 seconds. If the victim is not breathing, give 2 rescue breaths. Check for signs of circulation for no more than 10 seconds. And check for severe bleeding.
I need some help here.
If the emergency occurs on land, activate the emergency action plan. As you approach, survey the scene. If the victim is conscious and alert, get consent before providing care.
First aid, may I help you?
Yes.
Do every primary survey carefully to determine whether the victim has any life-threatening conditions. This allows you to determine how to provide the most appropriate care. If during the primary survey you find that an unconscious victim is not breathing but has a pulse, begin rescue breathing.
1 1000, 2 1000, 3 1000, 4 1000.
Position the resuscitation mask. Seal the mask and open the airway by tilting the head back and lifting the chin. Take a breath before you give a rescue breath.
1 1000, 2 1000, 3 1000, 4 1000.
Give one slow breath about every 5
1
seconds.
1000, 2 1000, 3 1000, 4 1000.
Each rescue breath should last about 2
1
seconds.
1000, 2 1000, 3 1000.
Breathing
4
too
1000.
hard or too long can force air into the stomach.
1 1000, 2 1000.
Breathe
3
just
1000,
enough to make the
4
chest
1000.
clearly rise.
1 1000, 2 1000, 3 1000, 4 1000. 1 1000, 2 1000, 3 1000.
After
4
1
1000.
minute of rescue breathing, about 12 breaths, remove the mask and recheck signs of circulation for no more than 10 seconds. Look, listen, and feel for breathing, for movement in response to rescue breaths, and feel for a pulse. If the victim has a pulse but is not breathing, replace the resuscitation mask and continue rescue breathing.
1 1000, 2 1000, 3 1000, 4 1000.
Give one rescue breath about every 5 seconds.
1 1000, 2 1000, 3 1000, 4 1000. 1 1000, 2 1000, 3 1000, 4 1000. 1 1000, 2 1000, 3 1000, 4 1000. 1 1000, 2 1000, 3 1000, 4 1000.
Recheck for signs of circulation every minute. If at any time you find the victim has no signs of circulation, begin CPR. You will learn more about CPR in another lesson.
1 1000, 2 1000, 3 1000, 4 1000. 1 1000.
If the victim vomits, roll her onto her side and sweep out the mouth. Continue rescue breathing until the victim begins to breathe on her own, another trained rescuer arrives and takes over, you are too exhausted to continue, or the scene becomes unsafe.
3 1000, 4 1000.
When rescue breathing for a child, follow the same basic steps as an adult, but the head is tilted back only far enough to allow your breaths to go in.
1 1000, 2 1000.
Breathe for a child at a slightly faster
1
rate than for an
1000, 2
adult.
1000. 1 1000.
Give one
2
rescue
1000.
breath about every 3 seconds.
1 1000, 2 1000.
Breathe enough to see the chest
1
clearly
1000, 2
rise.
1000. 1 1000, 2 1000. 1 1,000, 2 1,000. 1 1,000, 2 1,000. 1 1,000, 2 1,000.
After 1 minute or about 20 breaths, check for signs of circulation for no more than 10 seconds. Recheck for signs of circulation every minute. If at any time you find the victim has no signs of circulation, begin CPR. When doing rescue breathing for an infant, reverse the direction of the resuscitation mask, placing the nose of the mask on the infant's chin. Seal the mask over the infant's mouth and nose. To open the airway, tilt the head back slightly. Give 1 rescue breath about every 3 seconds.
1 1,000, 2 1,000.
Breathe only enough to see the chest clearly rise.
2 1,000. 1 1,000, 2 1,000. 1 1,000, 2 1,000. 1 1,000, 2 1,000. 1 1,000, 2 1,000.
After 1 minute, check for signs of circulation for no more than 10 seconds. Recheck for signs of circulation every minute. If at any time you find the victim has no signs of circulation, begin CPR. When you suspect that a victim has an injury to the head, neck, or back, open the airway using a jaw thrust because tilting the head back could cause further injury. Place your thumbs on the mask and your fingers under the angles of the jaw. Brace your elbows for support. Without tilting the head, lift the jaw to open the airway. To review, if during the primary survey you find that an unconscious victim is not breathing but has a pulse, begin rescue breathing. Position and seal the resuscitation mask. Open the airway by tilting the head back and lifting the chin. Take a breath before giving a rescue
1
breath.
1,000, 2 1,000, 3 1,000, 4 1,000.
Give 1 rescue breath about every 5 seconds for an adult,
1 1,000,
each
2
breath
1,000,
lasting
3
about 2
1,000, 4
seconds.
1,000.
Breathe for a child and infant at a slightly faster rate than for an adult.
1 1,000, 2 1,000.
Breathe just enough to make the chest clearly
1 1,000,
rise.
2 1,000.
Give 1 rescue
1
breath
1,000,
about
2
every
1,000.
3 seconds. For an infant, the resuscitation mask is inverted and placed over the nose and mouth. After 1 minute of rescue breaths, recheck for signs of circulation. If the victim is not breathing, continue rescue breathing until the victim begins breathing on his or her own, you are too exhausted to continue, another trained rescuer arrives and takes over, or the scene becomes unsafe. Remember to recheck for signs of circulation every minute and care for the conditions you find. An obstructed airway is the most common cause of respiratory emergency.
Are you okay?
First, determine whether the person is choking. If a person appears to be choking and is coughing forcefully, encourage him to keep coughing.
Keep coughing, keep coughing.
If a person can no longer speak, cough, or breathe, give abdominal thrusts to clear the airway.
Dial 911. This man is choking. I know first aid. Can I help you?
Stand behind the victim, placing 1 foot between the victim's legs, and position your hands. Find the navel. Make a fist with your other hand and place the thumb side of your fist against the middle of the victim's abdomen, just above the navel. Grasp your fist with your other hand and give quick upward thrusts. Each thrust should be a separate attempt to force the object out. Note, these skill demonstrations do not show the actual force needed to perform abdominal thrusts on conscious choking victims. Continue thrusts until the object is forced out, the victim starts to breathe or cough forcefully on his own, or another trained rescuer arrives and takes over. If the victim loses consciousness, gently lower him to the ground. If you determine that a conscious child has an obstructed airway, follow the same steps as you would for a conscious adult.
Are you okay? Keep coughing. Keep coughing. Keep coughing. Jay, call 911. This child is choking. I know first aid. Can I help?
Yes, please.
Depending on the size of the child, you may have to adjust your height. When doing abdominal thrusts on a child, use less force than you would for an adult. Performing thrusts with too much force may cause internal injuries to a child. If an infant is conscious but seems unable to make normal noises, or if the infant cannot cry, cough, or breathe, he may be choking.
John, call 911. This baby's choking.
Position the infant face down on your forearm, then lower your forearm to your thigh for support. The infant's head should be lower than the chest. Using the heel of your hand, give 5 forceful back blows between the infant's shoulder blades.
2 1,000, 3 1,000, 4 1,000, 5 1,000.
Position the infant between your 2 forearms, carefully supporting the head and neck. Turn the infant face up and again lower your forearm to your thigh. If the infant is still not coughing or crying loudly, locate the position for chest thrusts. Imagine a line running across the infant's chest between the nipples. Place your ring finger on the center of the chest, just under this line. With your next 2 fingers on the chest, raise the ring finger. Give 5 chest thrusts. Each thrust is a separate attempt to force the object out. Compress the breastbone smoothly about 1/2 to 1 inch. Continue with back blows and chest thrusts until the object is forced out, the infant can cough or cry clearly, or until the infant becomes unconscious.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.
To review, if an adult cannot cough, speak, or breathe, give abdominal thrusts.
Are you okay? Keep coughing. Keep coughing.
Call 911 or the local emergency number. Stand behind the victim. Position your hands. Give 5 quick upward abdominal thrusts. Continue thrusts until the object is forced out, the victim can breathe or cough forcefully on his own, or the victim becomes unconscious. For a child with an obstructed airway, adjust your height if necessary, and use less force when giving abdominal thrusts. If you determine that a conscious infant is choking, position the infant, give 5 back blows.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.
Turn the infant over and give 5 chest thrusts.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.
Continue with back blows and chest thrusts until the object is forced out, the infant can cough or cry clearly, or the infant becomes unconscious. You will learn how to care for unconscious choking victims in another lesson.
Are you okay? Can you hear me? Call 911. She's unconscious.
If during the primary survey you find an unconscious victim and your first 2 rescue breaths do not go in, you might not have tilted the head back far enough. Reposition the airway by tilting the head a little further back. And give another 2 rescue breaths. If your breaths still won't go in, assume the airway is blocked. Remove the resuscitation mask. Straddle one or both of the victim's legs and position your hands to give abdominal thrusts. Place the heel of one hand against the middle of the victim's abdomen, just above the navel. Place your other hand on top with fingers pointing toward the victim's head. Give up to 5 abdominal thrusts. Use quick upward thrusts to force air out of the lungs and help push the object out.
1,000. 5, 1,000.
Then sweep out the mouth. Grasp the tongue and lower jaw between your thumb and fingers and lift the jaw. To do a finger sweep, slide your index finger along the inside of the cheek using a hooking motion to sweep the object out. Replace the resuscitation mask, open the airway, and give 2 rescue breaths. Watch to see if the chest clearly rises. If breaths do not go in, reposition the airway and give 2 rescue breaths again. If the breaths still do not go in, repeat 5 abdominal thrusts. Each thrust should be a separate attempt to force the object out.
2, 1,000. 3, 1,000. 4, 1,000. 5, 1,000.
Continue thrusts, sweep, and rescue breaths until your breaths go in, the victim begins to breathe on his or her own, or another trained rescuer arrives and takes over. If you find that an unconscious child has an obstructed airway, follow the same steps as you would for an unconscious adult. If your first 2 breaths do not go in, reposition the airway. Tilt a child's head back only far enough to allow your breaths to go in. Then give 2 rescue breaths again. If your breaths still won't go in, assume the airway is blocked. Straddle the child's legs and position your hands on the abdomen, just above the navel. Give up to 5 abdominal thrusts. Use less force when giving abdominal thrusts to a child. Too much force may cause internal injuries.
3, 1,000. 4, 1,000. 5, 1,000.
Next, look for a foreign object by opening the child's mouth. Grasp the lower jaw and tongue. Look for a foreign object. If you see something, remove it by sweeping the object out with your little finger. Replace the resuscitation mask and give 2 rescue breaths. If your breaths still do not go in, continue cycles of 5 abdominal thrusts, foreign object check, and 2 rescue breaths.
2, 1,000. 3, 1,000. 4, 1,000. 5, 1,000.
Continue care until you can breathe into the child child starts breathing on his or her own, or another trained rescuer arrives and takes over.
Are you okay? Are you okay? Sean, go call 911. This baby's not responding.
If you find an unconscious infant and your first 2 rescue breaths do not go in, reposition the airway. An infant's head does not need to be tilted back very far to allow breaths to go in. Give 2 rescue breaths again. If the breaths still do not go in, position the infant face down on your forearm and lower your forearm to your thigh for support. The infant's head should be lower than the chest. Using the heel of your hand, give 5 back blows between the infant's shoulder blades.
3, 1,000. 4, 1,000. 5, 1,000.
Then, position the infant between both of your forearms, carefully supporting the head and neck. Turn the infant face up onto the opposite forearm. Lower your arm onto your thigh and locate the position for chest thrusts. Imagine a line running across the infant's chest between the nipples. Place your ring finger on the center of the chest, just under this line. Place your next 2 fingers on the chest and raise the ring finger. Give 5 chest thrusts.
1,000, 2,
Compress the
3,
breastbone
1,000,
about 1/2 to 1 inch.
5, 1,000.
Next, look for a foreign object. Grasp the lower jaw and tongue. If you see something, remove it by sweeping the object out with your little finger. If you do not see an object, replace the resuscitation mask, open the airway, and give 2 rescue breaths. If the breaths still do not go in, reposition the airway and give 2 rescue breaths again. If these breaths do not go in, continue with back blows and chest thrusts. Each back blow and chest thrust should be a separate attempt to dislodge the object.
One 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.
Next, look in the mouth. If you see a foreign object, use a hooking motion with your little finger to sweep the object out. To review, if you find an unconscious adult victim and your first 2 rescue breaths do not go in, reposition the airway and give 2 rescue breaths again. If your breaths still do not go in, assume the airway is blocked. Remove the resuscitation mask. Straddle the victim and find your hand position. Give up to 5 abdominal thrusts.
2 1,000, 3 1,000, 4 1,000, 5 1,000.
Sweep out the mouth. Replace the resuscitation mask and give 2 rescue breaths. If the breaths still do not go in, reposition the airway and give 2 rescue breaths again. Continue abdominal thrusts, finger sweeps, and rescue breaths until your breaths go in, the victim begins to breathe on her or his own, or another trained rescuer arrives and takes over. For a child, use the same steps as for an adult, but tilt the head back only far enough to allow your rescue breaths to go in. Use less force when giving abdominal thrusts. And if you see a foreign object, sweep it out. For an infant, if the first 2 rescue breaths do not go in, slightly reposition the airway and give 2 rescue breaths again. Position the infant face down on your arm and give 5 back blows.
2 1,000, 3 1,000, 4 1,000, 5 1,000.
Turn the infant over and give 5 chest thrusts.
1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000.
Look for a foreign object. Do a finger sweep only if you see an object. Continue breaths, back blows, chest thrusts, and foreign object check until your breaths go in, the infant begins to breathe, cry, or cough on his or her own, or until another trained rescuer arrives and takes over. If at any point rescue breaths go into the victim, check for signs of circulation and breathing for no more than 10 seconds. If there are signs of circulation and breathing, place the victim in a recovery position and continue to monitor for signs of circulation and breathing. If there are signs of circulation but no breathing, give rescue breaths. If there are no signs of circulation, give CPR. You will learn more about CPR in another lesson.
Are you okay? Can you hear me? Call 911, she's unconscious.
If during the primary survey you find an unconscious victim, send someone to call 911. or the local emergency number and continue with the primary survey. If the victim has no signs of circulation, begin CPR. To begin, find the correct hand position. Locate the notch at the lower end of the breastbone. Place the heel of one hand next to and above this notch on the center of the breastbone. Place your other hand on top. Position your shoulders directly over your hands. Give 15 chest compressions at a rate of about 100 compressions per minute.
1 and 2 and
Keep
3
your
and
elbows
4
locked and your
and 5
fingers
and
off
6
the
and
chest.
7, 8 and 9,
Compress
10,
the
11
chest
and
about
12
2
and
inches
13
deep
and
on an
14 and
adult.
15.
When you complete 15 compressions, give 2 rescue breaths. Take a breath before you give each breath. Each rescue breath should last about 2 seconds.
1 and 2 and 3 and 4
15
and 5
compressions
and 6
should take
and
about 10
7 and 8
seconds.
and 9 and 10 and 11 and 12 and 13 and 14 and
Counting
15.
out loud will help you maintain an even pace and rhythm. Watch for the chest to rise and fall to ensure your breaths are going in. Let the chest return to its normal position between compressions.
1 and 2 and
Keep
3
the
and
down
4
and up
5
motion
and
of
6
each
and
compression
7 and 8
smooth,
and 9 and
pushing
10
with the
and
weight of your
11
upper
and 12
body,
and 13
not
and
with your
14 and
arms.
15.
By compressing the heart between the breastbone and spine, you force blood containing oxygen to vital organs throughout the body. After 1 minute of compressions and breaths, about 4 cycles, recheck for signs of circulation for no more than 10 seconds. If there are still no signs of circulation, continue cycles of 15 compressions and 2 rescue breaths.
1 and 2 and 3 and 4 and 5 and 6.
Recheck for
7
signs of
and 8
circulation
and 9
every
and
few
10
minutes
and
to
11
determine
and 12
any
and
changes in the
13
victim's
14 and
condition.
15.
Continue CPR until the victim begins breathing or you can feel a pulse, another trained rescuer arrives and takes over, an AED becomes readily available,
1 and 2 and
you are
3
too
and
exhausted
4
to
and 5
continue,
and 6 and 7
or
and
the scene
8
becomes
and 9
unsafe.
and 10 and 11 and 12 and 13 and 14 and 15.
You okay? Are you okay? He's unconscious. Call 911.
If you find a child with no signs of circulation, begin CPR. CPR for a child is similar to CPR for an adult, but there are a few important differences. Find the notch at the lower end of the child's breastbone by sliding your middle and index fingers up the edge of the rib cage where the ribs meet the breastbone. Place your middle finger on the notch. Place the heel of this hand on the center of the breastbone next to where your index finger was. Place your other hand on the child's forehead and tilt the head back to keep the airway open. Position your shoulders straight over your hand with your elbow locked and give 5 chest compressions. Compress the chest about 1 1/2 inches at a rate of 100 compressions per minute. Give 5 compressions in about 3 seconds.
1 and 2 and 3 and 4 and 5.
Replace and seal the resuscitation mask. Open the airway and give 1 rescue breath, lasting about 1 1/2 seconds.
1 and 2 and 3 and 4 and 5.
Watch the child's chest rise and fall.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
After about 12 cycles of 5 compressions and 1 rescue breath, recheck for signs of circulation for no more than 10 seconds. If there are still no signs of circulation, continue cycles of 5 compressions and 1 rescue breath, rechecking signs of circulation every few minutes to determine any changes in the child's condition.
1 and 2 and 3 and 4 and 5.
If an infant has no signs of circulation, begin CPR. CPR for an infant is similar to CPR for a child, but there are differences. The infant should be on his or her back on a firm, flat surface, such as the floor or a table. Locate the correct hand position for chest compressions by imagining a line running across the chest between the infant's nipples. Place the index finger on the infant's breastbone just below this imaginary line, with the pads of the next 2 fingers on the infant's breastbone. Raise your index finger. If you feel the notch at the end of the infant's breastbone, move your fingers slightly toward the infant's head. Use these 2 fingers to compress the infant's chest straight down 5 times to a depth of about 1/2 to 1 inch, and at a rate of at least 100 compressions per minute.
1 and 2 and 3 and 4 and 5.
Replace the resuscitation mask. Tilt the infant's head back, take a breath, and give 1 rescue breath. Give 5 compressions in slightly less than 3 seconds.
1, 2, 3, 4, 5.
A rescue breath should last about 1.5 seconds.
1 and 2 and 3 and 4 and 5. 1 and 2
Keep the
and
down
3
and up
4
motion
and
as
5.
smooth as possible.
1 and 2 and 3 and 4 and 5.
After about 1 minute or about 20 cycles, recheck
1
for
and
signs
2
of
and 3
circulation
and
for
4
no
and
more than
5.
10 seconds.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
If there are still no signs of circulation, continue cycles of 5 compressions and 1 rescue breath. Recheck for signs of circulation every few minutes to determine any changes in the infant's condition.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
To review, if during the primary survey you check an unconscious victim and find no signs of circulation, begin CPR. Find the correct hand position. Give 15 chest compressions.
1 and 2 and 3 and 4.
Give 2 rescue breaths. After 1 minute, about 4 cycles, recheck for signs of circulation for no more than 10 seconds. If there are still no signs of circulation, continue CPR. Recheck signs of circulation every few minutes to determine any changes in the victim's condition.
1 and 2 and 3 and 4 and...
To do CPR for a child, find the hand position on the center of the breastbone. Keep the airway open. Give 5 compressions in about 3 seconds. Compress the chest about 1 1/2 inches at the rate of about 100 compressions per minute.
1 and 2 and 3 and 4 and 5.
Give 1 rescue breath, lasting about 1 1/2 seconds. After 1 minute, about 12 cycles, recheck for signs of circulation. If there is still no signs of circulation, continue cycles of 5 compressions and 1 rescue breath. Recheck for signs of circulation every few minutes.
4 and 5.
To do CPR for an infant, find the correct finger placement on the infant's breastbone. Keep the airway open. Give 5 compressions in slightly less than 3 seconds. Compress about 1/2 to 1 inch at a rate of at least 100 compressions per minute.
1 and 2 and 3 and 4 and 5.
Give 1 rescue breath, lasting about 1 1/2 seconds.
1 and 2 and 3 and 4 and 5.
After 1 minute, or about 20 cycles, recheck for signs of circulation. If there is still no signs of circulation, continue cycles of 5 compressions and 1 rescue breath. Continue CPR until the victim begins breathing or you can feel a pulse, another trained rescuer arrives and takes over, an AED is readily available and appropriate to use, you are too exhausted to continue, or the scene becomes unsafe.
No pulse. Continue CPR.
1 and 2 and
When there are 2 lifeguards available to perform CPR, one gives breaths and the other performs chest compressions. Guard 1 conducts the primary survey and gives rescue breaths. Guard 2 performs chest compressions. 2 rescuer CPR is more efficient than performing 1 rescuer CPR. Good communication is vital when 2 lifeguards work together to perform CPR.
EMS is on its way. How can I help?
no pulse. Begin CPR.
If the victim has no pulse, one lifeguard, guard 2, moves to the victim's side, finds the correct
1
hand
and 2
position,
and 3
and
and
gives
4 and
15
5
chest
and 6
compressions.
and 7 and 8 and 9
Counting
and
out
10
loud
and 11
helps
and
the
12
lifeguards
and
work
13 and
together.
14 and 15.
The other lifeguard, guard 1, gives 2 rescue breaths.
1 and 2 and
Give
3
15
and 4
compressions
and 5
in
and
no
6
more than
and
10
7 and 8
seconds.
and 9 and 10 and 11 and 12 and 13 and 14 and 15.
Each rescue breath should last about 2 seconds. Counting out loud
1
helps
and
both
2 and
lifeguards
3
keep
and
an
4
even
and 5
pace and
and 6
rhythm.
and 7 and 8
compression.
and 9 and 10 and 11 and 12 and 13 and 14 and 15. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15. Pulse check.
After 1 minute of compressions and breaths, about 4 cycles, recheck for signs of circulation for no more than 10 seconds.
No pulse. Continue CPR.
If there are no signs of circulation, guard 2 resumes compressions and CPR continues.
9 and 10 and 11 and 12 and 13 and 14 and 15.
If you need to change positions during 2 rescuer CPR, call for a position change by using the word change in place of the word 15 in a compression cycle.
12 and 13 and 14 and change.
At the end of a cycle, change positions. Guard 2 moves to the head with her own resuscitation mask and rechecks for signs of circulation for no more than 10 seconds. Guard 1 moves into position at the chest and on command continues compressions.
5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15.
Now watch the change again. Follow Guard 2 as she moves from the chest to the head. At the end of the cycle, she moves quickly to the head and rechecks for signs of circulation for no more than 10 seconds.
No pulse. Continue CPR.
If the victim has no pulse, give the command to continue CPR.
7 and 8 and 9 and 10
and 13 and 14 and change.
Watch the change again, following Guard 1 on the right. Guard 1 completes 2 breaths, moves quickly to the chest, finds his hand position, and waits for the command to begin.
No pulse. Continue CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
1 and 2 and 3 and 4 and 5.
Watch the change for 2 rescuer child CPR,
1 and 2
and notice how
and
both
4 and
lifeguards
5.
coordinate their movements.
Change and 2 and 3 and 4 and 5. No pulse. Continue CPR. 1 and 2
After the
and 3
change,
and 4
continue
and 5.
CPR with cycles of 5 compressions and 1 rescue breath. When performing 2 rescuer infant CPR, the rescuer doing compressions should use the 2 thumbs encircling hands technique. To use this technique, place your thumbs next to each other on the lower half of the infant's breastbone, ensuring that the thumbs do not compress the lower end of the breastbone. Put your hands around the infant's chest, supporting the infant's back with the fingers of your hands. Place your thumbs about 1 finger's width below the nipples. Use both thumbs to compress the chest approximately 1/2 to 1 inch deep.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4
After
and
each
5.
compression, release the pressure on the
1
breastbone
and 2
and
and
allow
3
the
and 4 and
breastbone
5.
to return to a normal position without removing the
1
thumbs
and
from
2
the
and 3 and 4
breastbone.
and 5. 1 and 2
Each
and 3
compression
and 4
and
and 5.
relaxation phase should
1
be
and 2 and
smooth
3
and
and 4
equal
and
in
5.
time.
1 and 2
Pause
and 3
after
and 4
5
and 5.
compressions and give 1 rescue breath.
1 and 2 and 3 and 4 and 5. 1 and 2 and 3 and 4 and 5.
Give compressions
1
at a
and 2
rate
and
of
3
at
and
least
4 and 5.
100 per minute, or nearly 2
1 and 2
compressions a
and 3 and
second.
4 and 5. 1 and 2 and 3 and 4 and 5.
After 20 cycles, recheck for
1 and
signs of
2 and 3 and 4
circulation
and
for
5.
no more than 10 seconds.
1 and 2 and 3 and 4 and 5.
If there are still no signs of circulation,
1 and 2 and
continue
3 and 4 and
CPR
5.
with cycles of 5 compressions
1
and 1
2
rescue
3 and
breath.
4 and 5. 1 and 2 and 3 and 4 and 5.
A bag valve mask is a handheld device used for rescue breathing or to assist a victim in respiratory distress. It also helps protect against disease transmission. The bag valve mask, also called a BVM, can be used by 1 rescuer, but is most effective when 1 rescuer seals the mask and keeps the airway open while another rescuer squeezes the bag to deliver ventilations.
3 1,000, 4 1,000, breathe.
Bag valve masks come in different shapes and styles, but they all have the same essential parts: a resuscitation mask with a one-way valve, and a self-inflating bag. Some BVMs come with the valve already attached. If not, attach the valve to the bag. There are also BVMs designed specifically for children and infants.
1,000, 2 1,000, breathe.
1 1000, 2.
To use a bag valve mask, first, assemble the BVM by attaching the mask to the bag and valve. Position the mask so that it covers the victim's mouth and nose. Next, seal the mask and open the airway. Place your thumbs on each side of the mask. Slide your fingers into position behind the angles of the jaw. Apply downward pressure with your thumbs, lift the jaw, and tilt the head back to open the airway. Begin ventilations.
3. 1 1000, 2 1000, 3 1000, 4 1000, breathe.
Give one ventilation about every 5 seconds, using only enough force to make the chest clearly rise.
1 1000, 2 1000, 3 1000.
Watch the chest rise and fall with each ventilation.
1 1000, 2 1000, 3 1000, 4 1000.
Squeeze the bag slowly for about 2 seconds.
2 1000, 3 1000, 4 1000, breathe.
For a child, ventilate at a slightly faster rate than you would for an adult.
1 1000, 2 1000, breathe. 1 1000, 2 1000, breathe.
Give one ventilation about every 3 seconds.
1 1000, 2 1000, breathe.
Squeeze the bag slowly for about 1.5 seconds.
1 1000, 2 1000, breathe. 1 1000, 2 1000, breathe.
1 1000, 2 1000.
For an infant, ventilate as you would for a child.
1000, breathe. 1 1000, 2
Give one ventilation about every 3 seconds.
2 1000, breathe. 1 1000.
Squeeze the bag slowly for about 1.5 seconds.
2 1000, breathe. 1 1000, 2 1000, breathe.
In review, to use the bag valve mask, assemble the bag valve mask. Position the mask. Seal the mask and open the airway. Begin ventilations.
2 1000, 3 1000, 4 1000, breathe.
For an adult, give one ventilation about every 5 seconds.
4 1000, breathe.
1 1000, 2 1000, breathe.
For a child and infant, give one ventilation about every 3 seconds.
1 1000, 2 1000, breathe.
Recheck for signs of circulation and breathing about every minute.
1 1000, 2 1000, breathe. 1 1000, 2 1000, breathe.